I'm Nicholas Decker. I'm an administrative laboratory director in Holland Hospital in Michigan. We're on the Lakeshore. It's a 191-bed facility, and it's a community independent hospital. We spend a lot of our time on the diagnostic stewardship aspect, as well as a very large focus on antibiotic stewardship. We chose LIAISON PLEX because of the customizable solutions that it offered. The ability to control the targets and the timing for our patients and clinicians felt like the right way to approach this kind of testing. We're firm believers in syndromic testing, but we want the ability to craft a perfect panel, for our patients. Probably the best attribute, if I had to pick a single one with PLEX, would be the customizability of the panels. A lot of other vendors don't give us much of a say in what we can run in our syndromic panels, and we really feel like this is the best product in the market for that. The key stakeholders will really drive how we choose our panels. The ED clinicians, the hospital medicine folks, they're really driving the decision about what they want and when they need it most so that we can yield the best outcome. Right now, the reimbursement market is just challenging to deal with, and a lot of the diagnostic tools we have don't take that into consideration. PLEX gave us a solution that really benefited my outpatient population in particular. We were able to remove a very large portion of our non-billable or non-reimbursable outpatient testing once we adopted the PLEX solution. That was something that we set out with in mind with a fiscal dollar amount and a percent improvement. We did not have a full season with the PLEX. We got started a little bit in the middle of respiratory season, but we actually still were able to exceed our target. It's not often that we get to yield positive clinical impact while decreasing costs at the same time, and that remains something we're very excited about. I believe the clinicians find value in the ability to use the same platform with the same collection type and get different targets based on their particular patients they come across. It really feels like we're able to help them right-size the panel for their patient needs, and I think that ultimately does deliver more value. LIAISON PLEX is actually a very smooth and easy system to operate. A lot of microbiologists and molecular technologists are not looking for a multi-step extraction technique. They really want us to try to make this solution simpler at every corner, but it also does reduce risk in cross-contamination or having multiple steps of point of failure. And it also ensures that we can run this test and this solution year-round and in the middle of the night with maybe less tenured staff. We are also always trying to return time to the technologist. The PLEX being sample to answer and also so simple in terms of workflow has allowed us to grow, tackle more volume, and do it while returning time back to the technologist. My organization is very focused on value-based care. It's one of the pride points that we take is that we always perform well in terms of value-based care. And I think this is one of those situations where flexibility allows us to perform better. We have to be able to deliver clinical quality. That's the ticket for entry across the industry now. If you're not doing well in that, you're not around anymore already. The future, I think, is being able to do it at a value.